Hello, everybody. This is Russ Curtis, again, professor, licensed clinical mental health counselor, counselor educator. Welcome. This is a question, if you're considering going into the behavioral health profession as a career, or if you're looking to get a professional to get help from, I just wanted to give an idea of how they might differ and how they're the same, the different behavioral health professions. Now, if it were up to me, we would have uniform licensure and we would decide on one title for all behavioral health professionals. And maybe that's the term we would use, behavioral health professional. Just like an accountant can have all different kinds of specialties, but when somebody says they're an accountant, we have a general idea. If somebody says they're an attorney, we have a general idea, although you could be a criminal attorney or a real estate attorney. I would love for us to have one single term, but we don't. Okay, so I also want to say that when I worked in mental health, I worked alongside psychologists, social workers, counselors, marriage and family therapists, nurses who specialize in psychiatry, and psychiatrists or specialize in behavioral health. And I find that we do a lot of the same things once we graduate from our programs, but the programs do have emphasis. So all I'm trying to say here is we do a lot of the same things. We all have the goal of helping people with mental health and behavioral issues, which includes addiction. But the programs can be different with their emphasis, okay? Now, there's a lot of overlap, so just be aware that when I go into this, I also want to say that I'm using the Bureau of Labor Statistics data, and I've tried to give the year here. It looks like May of 19 was the latest data I had, but you can go to the Bureau of Labor Statistics. I was also trying to look at agency work versus private practice when I could, when I was getting the income data. So let's start with psychology. I've also given a key figure that's recognizable with psychology, and Sigmund Freud is one of the key figures there. Now, they can be excellent clinicians. They can also be researchers and educators and so forth. But an emphasis of psychology that is somewhat different than the other fields would be an emphasis on testing, assessment, and diagnosis. When I teach the test and measurement class in my counseling program, I consult with a psychologist who knows a lot about test and measurement and different issues like that. Doesn't mean they're also not good clinicians. It seems from what I gather when I talk with psychologists that they definitely get training in psychoanalysis. They also get training in cognitive behavioral therapy. Maybe not as eclectic, but it depends on the program and other types of modalities. But definitely good clinicians. And a psychologist friend of mine said that when he goes to the American Psychological Association meetings, there's a lot of emphasis on integrated care, on the behavioral health folks working within medical settings, ERs, oncology units, family practitioner units, and so forth. When he will go to counseling conferences, there's a huge emphasis on diversity and making sure that we're meeting the needs of marginalized and oppressed populations and so forth. So just to give you an emphasis, you see the income figures. The total number of psychologists and this was again May of 19, was over 113,000. Median pay is 78,000. Okay, we use the median and not the mean because the median is going to give us that center point, because there could be and probably are psychologists in private practice that make a lot of money, but that would skew it for the folks who are kind of working in agency settings. Social work. Oh, by the way, I should also say in my university we have a Master's of Psychology program, Master's of Social Work. There's actually a doctorate in psychology now. So I've got kind of colleagues that we consult with in all those areas. Social work, again, we're talking about the emphasis. There's an emphasis on systems of care, family work. There can be micro and macro programs. There seems to be more of an emphasis on grant writing and getting funding to help people in poverty. There's also on kind of agency management. How do we run a Department of Social Services? In my mental health center where I worked, we had a social worker person, a social worker who was responsible for grant writing that got a big grant to create an apartment complex for our clients who had severe and persistent mental illness, mostly with schizophrenia and bipolar, schizoaffective. And it was a wonderful complex that they had there, that we had everybody. We had, they had activities they did together. They had cookouts. They had socials. It was easy for me to get to do assessments and to counsel folks because we could go to one central location. So Jane Addams is a key figure, clearly, with social work, over 700,000 social workers, in the median pay of 50,000. Okay. Psychiatry is a medical profession, okay? So people go to medical school, and then as they progress through medical school, they take a lot of the general same classes, but as they progress, they will specialize. So somebody could say, hey, I'm going to specialize in oncology or cardiology or psychiatry. And our psychiatrist in the mental health center mostly focused not so much on the therapy, although they had to have good interrelational skills and understand counseling, but they were really focused on the medication and also the medical stuff. I mean, they would take blood pressure and listen to the heart rate and all that, which was really critical for folks to make sure that we were giving them the care they needed. Okay, so just make aware, those medical doctors there, and they prescribe medicine and also can evaluate for commitment. It depends on the states. But at last that I saw, there were about 25,000, and the median pay was 220,000 for psychiatrists. Now, counseling, and that's what I am, a licensed clinical mental health counselor. The emphasis is on prevention, so we see a lot of that in the schools, a lot of classroom guidance. We at our program produce some wellness magazines that are to celebrate art, but also to provide wellness information and resources. Just an example. And very focused. And this was founded by Frank Parsons, the counseling profession, from a vocational guidance. And so that's where really the wellness and prevention comes, is like helping match people with their interests and skills with the right careers. So that's where it was founded. We teach a very integrative model. So from day one in the counseling program, you're actually practicing counseling skills, either individual, group, and family. And that is our emphasis, is on getting people in really good shape and practicing counseling with individuals, groups, and families. There's over 300,000 counselors at last count. Median pay is 46,000. Again, private practitioners do a lot better than that. We're looking at agency numbers. And then marriage and family therapists. Again, I worked with marriage and family therapists, offices right next to me in mental health. Focuses on marriage and family and more systems of care and how do we do couples care. And so in almost all programs, you'll take probably a family therapy class and learn about solution-focused therapy and all the different types of working with couples and families and so forth. What we've got here is over 55,000, the median pay of 49,000. And so anyway, those are just some of the major behavioral health professions. I know really great counselors who are not in the behavioral health field. In order to bill for services as a behavioral health professional, you do have to be licensed as one of these primary practitioners. And hopefully that this provides a little bit of clarity. I don't like the turf wars that are out there. Again, I'd love for us to have uniform licensure. But I'm hoping that this provides a little bit of clarity if you're thinking about a program or if you're thinking about receiving care from somebody. Word of mouth, always ask around when you're calling if you're wanting to get care, interview people. A lot of people will provide like the first 30 minutes free so you can get a feel. The relationship is the single best predictor of client outcome, so you must feel comfortable with the person. Just a couple things to keep in mind. All right, I hope this is helpful, and we will talk to you on the next video. Take care.